Hello, everybody. This is Patrick Long, founder of Hero Health Plans, and I'm here today with one of our partners, friend, mission-driven PBM and CEO, Vinay Patel. And Vinay, we wanted to ask you a few questions, get a little bit of inspiration from you. You were kind enough to fill out some things for our blog here. I met Vinay. I was listening to a podcast with Stacy Richter, undoubtedly in my mind the best podcast in healthcare, Relentless Health Value podcast. And I looked down, and she had all these leading lights of healthcare, heads of surgery centers, heads of all sorts of important jobs, and they all had an hour interview with Stacy Richter. And here's this guy I haven't heard of who had two sessions back to back with her. And I thought, wow, this guy must be really important. So I scrolled down and listened to that. And then afterward, I talked to Stacy and I said, that was a really good interview. And she said, he lives right near you. And so I called up. That was just the coincidences in healthcare. And so I called up Vinay, and we've been friends ever since. But I wanted to share a little bit about why I'm so excited whenever I get to meet Vinay. And I've got some information here from him. But Vinay, you want to tell us a little bit about, your journey and kind of, I know we talked about, you went to school in Florida, you're a PharmD. Your wife, Honey, and two kids are in Raleigh. Tell us a little bit more about your mission, though. You said it's to simplify healthcare and make it more affordable. And that, to me, sounds a little bit, generic, but I know you live that because you help working people. Can you give us some examples of, what have you done to move the needle for working people and employers?
Great question, Patrick. It seems like the work we've done together has accomplished so much over the last 3 years now, that it's hard to distill. And I think it starts with a model that's the complete opposite of what exists today. The status quo by design has made healthcare so immensely complicated that healthcare professionals, people that work in the industry, can't even understand it themselves. And being able to navigate it is a whole nother ball of wax. And so we started with simplifying healthcare, which starts with, let's find the true cost of a drug and let's make sure that's transparent to everyone, whether it's a penny, $10, $100, or $10,000. Let's everyone start with a source of truth that helps you understand this is the true cost that pharmacies are buying medications for. There's plenty of people touting different prices for drugs depending on which, what insurance you have, where you belong, what age you are, what race you are. Sometimes it's crazy. And so we got one true cost of the drug, and then we added a simple model that says cost plus. I know that it's wildly famous now because we have Mark Cuban with his megaphone touting, and that's helped all boats rise.
You were a couple of years ahead of Mark Cuban, but he has a slightly larger following on social media, I think.
So that's where it all started, to simplify pharmacy and our little world in healthcare. And it's really about, once we got to that simplification, then we could all focus on the value, which is
right.
How is pharmacy a tool to help everyone be better, receive better care, and really lower the overall healthcare costs for plan sponsors and members.
That's great, and I know that the cost plus model, it all starts there. But then what you do differently, and maybe you could tell the audience a little bit about this, is everyone else goes to the big chain stores. So they want to partner with Walgreens and CVS and Walmart and Costco and get all that volume and all that money. But you went completely 180 degrees in the other direction and partnered with locally owned pharmacies. Can you tell us a little bit about why and how that works?
Yeah, so as a pharmacist working in various different settings of pharmacy, I've gotten to see a little bit of everything through my career. And what I realized early on was that there's great pharmacists that work in every setting of pharmacy, but really the pharmacies that have the time to provide better service and better quality of care are these local hometown pharmacies. And you really don't get to hear about them today because all of the marketing and noise and attention that the big chains get, and they have a lot more leverage to get in front of you, in front of eyeballs. And so you forget that you have your local hometown pharmacy there. And a lot of the people that we've talked to across North Carolina, when we tell them we're working with local hometown pharmacies, sometimes we get applauses. Sometimes we get people that finally, they'd say, thank you. Finally, for years, we've been told we can only work with, I only need to go to CVS or get my drugs through the mail. And now we're reconnecting people back to local hometown pharmacies for better quality of care, better service and services and things that you just aren't aware of today, right, to bring awareness.
Yeah, the whole thing about somebody knowing your name and helping you with what we like to call meducation, about so many people don't know what they're putting in their bodies, but local pharmacists have a vested interest in their community and help accordingly. But you're just, I know you started out in North Carolina where we're based, and we worked on employer plans here for the last few years. But just like you've expanded, so have we. And now are there any states you're not working in, or are you coast to coast? Are you everywhere? And how many pharmacies are we talking about are local versus chain store?
That's a great question. So we're coast to coast. We have a pharmacy network that's roughly about 18,000 local community pharmacies and grocer pharmacies in our Cost Plus network across the country. And so there's pockets of areas where our coverage can be improved. We're always happy to go get local pharmacies in that area, but in general, we can cover the majority of the populace of the country where they live, and of course definitely have access in the more suburban and rural areas because of that.
And like with our plans, but I don't know if that holds true for everything you do, but you can go to any pharmacy, almost 70,000.
That's right.
If you choose to go local,
that's right.
Our plans, you pay $0 for the generic drugs, and you get better service. That's and super competitive pricing, because when so many local stores band together, they get the same or better pricing than the chain stores.
Right.
Yeah, that makes complete sense.
Right.
Well, back to you. I was joking with you before we started because you told me that your mission was to work on healthcare and make it more affordable, and you're reforming and restoring healthcare, especially in the pharmacy area. And then to relax, you restore your house, and so you never stop. You must have that must be part of the DNA, right? That you're continually you've got to tinker with something and improve it all the time. So that I really enjoyed that. And you said your favorite quote was, "Sometimes the questions are complicated and the answers are simple," from Dr. Seuss, Theodore Geisel, which I love. But that also has a lot of applications in what you do and what we do here in improving employer plans and working families. And what would you say? How does that apply to the pharmacy world from your perspective? Because so many people have really elaborate questions about the complexities of healthcare, and tell us a little bit how you make it simple.
Educating people to navigate healthcare and asking the right questions, or having prompt questions to make sure that you're getting everything out of your health and your well-being is so important. And once you start informing people about, okay, well, have you thought about this? Have you discussed this with your doctor? Did you know there were other options? All of that education that comes with almost a Socratic method of teaching people on getting to the right answers is continually asking questions, has really been helpful to help people distill and understand not only how to take care of themselves, but access pharmacy and healthcare and the relationship. I mean, it's all connected.
That's my last question for you is, because I know how you work and I know how much value you bring to employers and their working families, both on the care and the cost side. But what's been most interesting to me has been that other PBMs, other pharmacists, and other plans are designed in silos, right? You have the pharmacy side and the medical side, separate from the ancillary side, separate from everything else. And we make it even more difficult for an employee who just sees one ID card to make sense of all that and to act accordingly. And what you've done is collaborate and communicate with the nurse navigators, with the other side of the plan, with the customer service. So bringing that human touch to a big health plan has been invaluable. And I've seen that has been sure, everyone likes lower costs. Everyone appreciates getting better care or information about the drugs, but that collaboration and communication is where the magic happens. And can you tell us, how do you see that growing as these employer plans are taking off everywhere now? How do you maintain the human touch at scale?
The one method that we've started to tinker with or started to utilize is leveraging, I think I'll take a step back here. Healthcare, like technology and what we've seen come in the age of the internet, is a lot of shiny objects, and we've tried to take a shiny object, which is tech and the fancy tools that tech comes with, to try to change healthcare. I think that it needs to be the opposite. We need to utilize tech to improve on the human care that people can already provide. And so we're leveraging the technology tools, data analytics, and the power of these really sophisticated systems to distill the right information at the right time. So we look at thousands of claims every day, and today we do it manually, and we find opportunities to help people and outreach to them. Tomorrow, when we have 10,000 claims we got to look at every day, we'll have a computer system, AI, or whatever, whatever we want to talk about, the newest technology of the time, to say, okay, well, here's all the rules, identify all the opportunities for me, and it takes a couple of minutes to do the grunt work, and then it takes 100 minutes to do the outreach to the patients and connect with them and share the valuable information that humans have, that people that are experts in pharmacy can share with people that need to know it.
That's great. Well, I'm looking forward to that. And Vinay, it's been a pleasure getting to know you, working with you, and really seeing the impact you've had on working people and the employer plans. And we're really excited about the future. So thanks for joining us today.
Thanks, Patrick.
All right. Take care.
Bye.